Hi, you guys. Welcome back for our daily practice questions. It is day 82, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine, right? We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. And if you're looking to enroll in the upcoming F&P and AGMP 5-week review that starts April 21st and runs through May 30th, make sure you grab that last spot with the link in the description. All right, question number 1. Which of the following is primarily responsible for transmitting sound and balance information to the brain? Is it cranial nerve 1? Is it cranial nerve 2? Is it cranial nerve 7? Or is it cranial nerve 8? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what they're even asking you, right? Before you can read all the fluff and create your own storyline, read that stem so you know what you're supposed to be focusing in on. In this scenario, the stem is the question is the stem. And it states, which of the following is primarily responsible for transmitting sound and balance information to the brain? And the best answer is D, cranial nerve 8. Remember, 8 is your acoustic, right? That's sound. All right, question number 2. Which cranial nerve is responsible for the sense of smell? Is it A, cranial nerve 5? Is it B, cranial nerve 7? Is it C, cranial nerve 1? Or is it D, cranial nerve 9? Take a moment, tell me what you got. All right, stem here states which cranial nerve is responsible for the sense of smell. And your best answer is C, cranial nerve 1. Remember, we have one nose, right? One nose, cranial nerve 1. All right, and lastly, question number 3. Which of the following cranial nerves is responsible for taste sensation on the anterior 2/3 of the tongue and also controls the muscles of facial expression, including smiling and blinking? Is it A, cranial nerve 7? Is it B, cranial nerve 9? Is it C, cranial nerve 10? Or is it D, cranial nerve 12? Take a moment and tell me what you got. All right, and STEM states, which of the following cranial nerves is responsible for taste sensation on the anterior 2/3 of the tongue and also controls the muscles of facial expression, including smiling and blinking? Remember, y'all, that is the facial nerve, right? And that's cranial nerve 7, so the best answer is A. All right, you guys, I hope you found this helpful. I wanted to do some days of cranial nerves because I get a lot of questions on trying to retain these and things. So I wanted to put it in a question format to help you apply it, help you see it in different ways so that you can know how to approach this on exam day. So I hope that you found this helpful. If you have not watched them, there's about 4 different days of 3 questions on cranial nerves. So if you need to review it, it's up on the channel. But as always, y'all be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions or any of my custom packages or plans or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.